Hey guys, Dr. Courtney here, and today I'm going to be talking about what I think makes a beautiful smile. Again, I'm going through Invisalign treatment right now, and a lot of people say, your teeth are perfect, what are you doing? What are you really fixing? But let me tell you, today you're going to learn. Alright, so I'm going to start this by just zooming in on my smile so you can kind of see what it looks like and what I look for. And I'm going to show you some still pictures too. Okay, so one of the things I like to educate my patients about is the teeth and how your smile should fit your face. The indication of a youthful smile is showing more tooth show on your top teeth at rest. So at rest means when I'm just kind of sitting there pouting like this, okay? Or when you smile, you also want to show as much tooth as possible, like this. Sometimes people get orthodontic treatment done. When they straighten their teeth, the teeth actually start to hide below the upper lip. So when they smile, you see less and less of the top teeth and more of the bottom. That is an aged look and what I consider unaesthetic. You know, look at the typical 80-year-old. When you have a conversation with them, you see a lot of their bottom teeth. Another thing that keeps a youthful smile looking youthful is the width of your smile. So when you smile, I want to see your teeth go all the way back. On older people, things start to constrict over time, so you see less and less of those back teeth. And again, that's an aged look. We want a wider smile because it provides support for your soft tissue. Just think of people who wear dentures. They remove their dentures, all that soft tissue support is gone and their face gets really collapsed and tiny. So again, let's keep things looking youthful. So the goal of orthodontic treatment, not only is it to straighten your teeth, but to make sure that your smile fits your age, fits your face, and really is in harmony with everything. So when we look at my smile, one of the things that I am trying to protect during my treatment is something called the smile arc. And what that means is when I smile, the edge of my top teeth follow the curvature of my lower lip. And I'm almost there, right? But I'm OCD. So what I'm working on with my Invisalign is I'm trying to get these two teeth here, the lateral incisors, to come a little bit forward and a little bit down. Again, it is OCD. I am almost done. But you know, these are the things that when I treat patients, this is what I look for. So that's it. That's my video for today. But you know, those are the things I look for. So you know, just be mindful of the treatment that you're getting, and you know, if you have any questions about your treatment, be sure to ask your doctor. You know, educate yourself and let them know like what you're looking for and make sure those are your goals. All right, well, that's it. I'm gonna go and share my smile with the world. Have a great day.